I would like patients to be able to know that even if they've been struggling with a condition or symptoms for a long time, that there may be an option that they haven't heard of. And that option may be interventional radiology. For instance, there are women who go years after knowing that they have fibroids and not doing anything about it. And that may be because the treatment options that have been provided to them are not quite in line with what they think they want. So an interventional radiologist may be able to provide that minimally invasive treatment option, such as uterine artery embolization. So for example, if you look at women who know they have fibroids, the delay in actually getting treated is about 3.5 years. And part of that is probably because it's not a cancer, so they don't have to have a treatment, but it's heavily impacting their quality of life. And I see those kind of women often in my clinic, and they're tearful about their quality of life and how poor it is. And they just don't know that there's an option other than surgery or medication, things that have potential long-term side effects or have long recovery. Mm-hmm. And so they don't have the time to take off after a surgery, and they need some kind of different option for treatment. If they don't know about uterine artery embolization, they can suffer with those symptoms for a long time, 3.5 years on average, before they do something about their symptoms. I'd love them to know that they can find us, and they can find an interventional radiologist nearby them who can potentially provide them a different treatment option. Interventional radiologists can be helpful in a lot of women's conditions, and a lot of them are less well known than fibroids. So I like to think of it in two broad categories, dysfunctional uterine bleeding of any type and pelvic pain. And those are two big categories where interventional radiology can really help a woman who's seeking out other options for treatment. So those may include things like fibroids, as we discussed, or adenomyosis, postpartum hemorrhage, arteriovenous malformations of the uterus or arteriovenous fistulas. And we can even be helpful in a condition that's called pelvic congestion syndrome. Some people now refer to it as pelvic venous disease. And so there are many, many ways in which an interventional radiologist treats women's health conditions outside of fibroids.
For the patient, I think if you're a woman and you're experiencing abnormal bleeding or pelvic pain, and you feel like you've not gotten the right answer on what your option is, you should look. You should contact an interventional radiologist.
I think one of the common misperceptions is that, in order to see an interventional radiologist, you have to go through a referring physician. And while you can come that route, and a patient can get to us via a referring physician, and we like that collaborative relationship, a patient can also come to an interventional radiologist without a referral. So they can, what we call self-refer, just call an interventional radiologist's office. They can find an interventional radiologist via the Doctor Finder on the Society of Interventional Radiology's website. They can go to see an interventional radiologist without a referral. They don't have to have necessarily any imaging or any medical documents with them. They can just come tell us their story, tell us their history, and see if there might be a minimally invasive way to take care of their symptoms.